Have you had long-standing back pain or even problems with your spine, whatever they may be, that have been going on for quite some time? You may have tried different treatments or seen a variety of different professionals, but you still haven't got to the bottom of the problem. My name's Anthony Ghosh. I'm a consultant spinal neurosurgeon and founder of the Spine MDT. And in this video, I'm going to discuss a slightly different approach, regardless of what your spine problem is, to try and get you a long-lasting result. Back pain or any spine disease is managed by a number of different professionals, and that could be spine surgeons, pain specialists, osteopaths, chiropractors, and physiotherapists. It's not necessarily that one discipline is better suited, it's that I often see these disciplines or professionals from these disciplines working completely independently of each other, and then when the limits of their ability are reached, a patient is often then referred to another professional of another discipline, and the same thing seems to happen again. Studies have shown that bringing together the opinions and skill sets of these professionals of different disciplines will get a better result. And this is called a multidisciplinary team. We have enough data to show that people who do not suffer with back pain, who have never experienced back pain, will still have wear and tear findings on their MRI scan, either in the discs between the bones or even the facet joints at the back of the spine. Unfortunately, these findings have become overemphasized, and that has led to patients going down the wrong avenue of treatment, sometimes with a physiotherapy focus on core strength, for example, to strengthen an area that's presumed to be weakened in the spine, or worst case scenario, patients undergoing unnecessary surgery to fuse a segment, join these two bones together because there's some degeneration of the discs. Most of the time, the cause of the pain isn't actually purely structural, but when it is, it's quite useful to have a surgeon, for example, go through the scans thoroughly, interpret them in conjunction with the clinical findings, as well as having that discussion with another therapist, for example, a physiotherapist or an osteopath. And if it is purely structural, they can agree on the right management plan or right types of exercises, stretches, or manual therapy and the areas to target to help give you a long lasting improvement of the pain. And in some scenarios, pick a target which might actually be amenable to surgery. Most of the time, the cause is actually functional, and by that I mean it's not purely structural where there's an actual target or an area of wear and tear that's a direct contributor to the pain, but mostly it's down to secondary things like the way we move, certain behaviors we adopt, and these can be corrected and worked on with the right type of physiotherapy approach and also the right oversight and interpretation of any scans that you've had. When surgery is required, it's important to realise that that's not going to work on its own. I often use a team of physiotherapists, osteopaths, or even pain specialists in conjunction so that patients can get the best possible outcome. So, for example, if you slip a disc in your spine and it pinches a nerve, and you've undergone a procedure, an operation of microdiscectomy to shave away that bit of disc and free up the nerve, you still need to build up the muscles that support and surround the spine so that they can strengthen from the disruption that's happened in surgery, and also try and get people to adopt a newer lifestyle that's generically more healthy that can help prevent recurrences. So, in summary, a team approach with the leader of that team having overall oversight of your care and taking responsibility is what's going to give you a more definitive and long lasting result.